G'day, kia ora, welcome to the Career Doctor channel. Just posting a quick video about a rare find. So I saw this on Seek the other day. It's for a cardiologist in Queensland. And why is this a rare find? Well, firstly, any cardiology job in Australia is a pretty rare find. Cardiology is a very, very competitive specialty here. It's particularly difficult to crack into if you're a specialist cardiology from another country and don't have any connections here. And that brings me to the next point as to why it's an even more rare find, because this is the first time in a long time I've seen the three letters AON, which stands for area of need. Now, let's click on it and just have a little bit of a further look. So it is advertised by HPG, Healthcare Professionals Group. So I haven't come across this group, but that sounds like a recruitment company. And indeed, if we Google them, you can see that these are indeed a recruitment company. So let's click on it and have a look. Can we get that in a new tab? Yeah. So cardiologist in the New Auckland Gladstone, so that's central Queensland. So it's regional Australia. So that's probably why they're having a bit of trouble filling this spot. Quite a vast salary range there, from $0 to $1 million. So that sort of validates one of the recent videos I've done about how cardiologists tend to be in the higher earning groups in Australia and internationally. A bit of info about what it's about. It's a cardiologist with an interest in cardiac imaging. So that would probably include interventional. There's a hospital and community network, non-invasive multimodality cardiac imaging, so perhaps not so invasive. They want you to be able to do echoes, stress tests, etc. And then here's the kicker. So ideally you would have a fellowship with the Royal Australasian College of Fellows in Cardiology, or deemed substantially comparable by the RACP. Now, the rates of comparability and the rates of substantial comparability are reasonably high with the College of Physicians. Comparability is about 80%, just under, for all candidates from all countries. I forget what the rates of substantial are, but I think they're in the 60s. I'll pop it on the screen. And I've certainly met a number of candidates who have achieved that from overseas. So you would be eligible to apply for this, although you will be competing with those who probably already or recently achieved their fellowship. Now, interestingly, nothing there about actual area of need. So I think they've just used that as a bit of a kind of title in the ad. This looks like a fairly new, maybe, recruitment company, so maybe they're not quite familiar with what that means, because there's actually nothing about applying for the area of need, and there's actually not anything about. So if you would do area of need, they'd interview first and then you'd apply to the college, and that's not the way this is running. So they're really wanting you to have gone through what now the RACP calls the standard specialist pathway, not the accelerated one, and apply that way. So there you go, a rare find for cardiology that a specialist IMG would be eligible for.